Hi everyone. In this lecture, we are going to discuss about the anatomy and function of the Eustachian tube. The Eustachian tube was first described by Bartholomeus Eustachius under the term pharyngotympanic tube, as this tube connects the tympanic cavity with the nasopharynx. Antonio Valsalva was the one who coined the term Eustachian tube in order to honor the contributions of Bartholomeus Eustachius. Just like the external auditory canal, the Eustachian tube is also made of a bony part and a cartilaginous part. The lateral one-third of the Eustachian tube is made of bony canal of the temporal bone. The medial two-third is made of cartilage. The junction between this bony part and the cartilaginous part is called as the isthmus, which is the narrowest part in the Eustachian tube. The cartilaginous part is not a complete canal where it is formed by lateral lamina and medial lamina connected together with elastic hinge. The tensor palatini muscle is attached to the lateral lamina, whereas levator velar palatini muscle is attached to the medial lamina. The part which is uncovered in the cartilaginous structure is filled with Osman's fat pad. The anatomy of Eustachian tube is in such a way that in adults, the length of the Eustachian tube is around 35 to 38 millimeter long, and it is oriented in anteriorly, inferiorly, and medially, making an angle of 45 degrees with horizontal and sagittal planes. Now, this opens into the nasopharynx approximately around 1.25 centimeter from the posterior end of the inferior turbinate. This orientation of the inclination of the Eustachian tube into the nasopharynx varies from infancy to adult. So in adults, it makes almost 45 degrees with the sagittal plane and the medial plane. Now, when we compare this orientation with infants, the infants have almost horizontal orientation of the Eustachian tube, and the isthmus is wider. It's not as narrow as it is seen in the adults. In adults, there is a clear inclination of around 45 degrees from the tympanic cavity to the nasopharynx. This tabular column will help us to understand what is the difference between the anatomy of Eustachian tube in adult and infants. So the length is around 18 millimeter in infants. The angle with which horizontal plane is around 10 degrees. So it is almost horizontal in infants, whereas it is 45 degrees in adults. The lumen, the opened cavity of the Eustachian tube, is narrower in adults compared to wider in infants. At isthmus, the angulation is present in adults, whereas it is absent in infants, making a direct communication between the medullary cavity or the tympanic cavity to the nasopharynx. The cartilaginous structure is rigid in adults, whereas it is more flaccid in infants. The elastic recoil of the cartilage, we'll discuss about how this recoil is going to help in functioning of the Eustachian tube later. So this elastic recoil is very effective in adults, whereas it is ineffective in infants. And the density of Osman's fat at the cartilaginous part of the Eustachian tube is more in adult and less in infants. The muscles that are associated with the Eustachian tube are the levator velar palatini, tensor velar palatini, salpingopharyngeus, and tensor tympani muscle. The nerves supplied to the Eustachian tube are sphenopalatine ganglion, the mandibular nerve, and the tympanic plexus. The arteries that supply to the Eustachian tube are the ascending pharyngeal artery and middle meningeal arteries. The venous discharge are through the pharyngeal plexus and pterygoid plexus. Lymphatic drainage happens through the retropharyngeal. Moving on to the functions of Eustachian tube, it can be divided into three functions. The first one is ventilation or maintenance of air pressure. The Eustachian tube maintains air pressure between the external atmosphere and the medullary cavity. As we know, medullary cavity is a airtight cavity. It is surrounded by the tympanic membrane, the mastoid air cells, and the Eustachian tube, which remains closed most of the time. Now, when we chew or yawn, what happens is that the Eustachian tube opens and neutralizes the air pressure in the middle ear compared to that of the ear canal. So it matches the air pressure between the tympanic cavity and the external atmospheric pressure. So this keeps the tympanic membrane in optimal position for efficient vibration. The second function of the Eustachian tube is drainage. So there can be secretions present in the middle ear cavity. So these secretions should be drained into the nasopharynx. So if there is any infection, whenever the Eustachian tube opens, whatever secretions that is present in the middle ear cavity will be drained into the nasopharynx. So in that way, it keeps the middle ear cavity clean. The third function is the protection. When a sound is being produced or when there is a infection in the nasopharynx, these infections are prevented from entering into the middle ear cavity because the Eustachian tube remains closed most of the time. Now, the bony part is always open, whereas the cartilaginous part is always closed at rest. So whenever there is a activity like swallowing, yawning, sneezing, or forceful inflammation, this cartilaginous part opens. The opening of cartilaginous part is accompanied by the contraction of various muscles. So the opening happens through the active process of contraction of tensor veli palatini muscle, and a passive opening happens through the contraction of levator veli palatini muscle. So both this tensor veli palatini muscle and levator veli palatini muscle helps in opening the lumen of the Eustachian tube. An active contraction of the tensor veli palatini muscle and a passive action of the levator veli palatini muscle. The closing of Eustachian tube happens with the recoil of elastic hinge. So when the tensor tympani muscle is contracted, it pulls the lateral lamina of the Eustachian tube away from the lumen. Okay, so once the muscle is relaxed, this elastic hinge contracts or recoils, closing the lumen of the Eustachian tube. The other one is the Osman's fat pad. So Osman's fat pad is stretched here. So once the contraction is released, this will recoil back to its original structure, thereby closing the lumen of the Eustachian tube. So this is how opening and closing of the Eustachian tube happens whenever we yawn, sneeze, or chew, swallow, or during forceful inflation. This is a reference for the lecture. Thank you.